Hi everyone. Today we have amazing editor's choice article and two wonderful authors of the article of the journal Cephalalgia. Congratulations to Dr. Schlosser and Dr. And nurse Annette Rasmussen with this wonderful award. It was editor's choice by Dr. Sacco from journal Cephalalgia. And I would like to give opportunities to our wonderful authors to introduce themselves. So maybe first author can start and then corresponding author. Please, Dr.
I can start, yes. My name is Louise Schlosser, and I'm an associate professor and a nurse specialist at the University Hospital of Southern Denmark and the University of Southern Denmark. I've been involved in research for the past 10 years, and my research primarily focuses on non-pharmacological treatment and clinical optimization, and of course, nursing in headache treatment.
Fantastic.
Yeah, and my name is Annette Vangaa Rasmussen. I am a nurse. I have a master in headache disorders from the University of Copenhagen. I work at the University College of Zealand, and I have worked within the headache field for the last 18 years.
This is amazing. Thank you so much for your work and all you do. And Annette, could you please let us know what brought you to writing and participating in this amazing work about role of nursing and what headache centers can do together for our patients?
Yes, I would. It all comes from the interest in headache, of course, and then also because we have gathered internationally as well in the International Forum for Headache Nurses, where I am a president for that association. And so what we experience when we meet at local meetings and at international headache congresses is that we are a lot of nurses, and we experience that the patients are the same, but we have different ways of and opportunities in treating our headache patients. So that's why we got interested in how can we actually get a kind of consensus on what can a nurse do in this headache field, and how can the patients benefit if we get together and get a consensus. That was the overall inspiration to start this study.
Wow, this is great. Thank you. And how did you approach it? What were the methods?
I can answer this one. We wanted to hear the experts around Europe, around the headache centers. So we did a literature review to see what is known in the field of nursing and migraine treatment. And we found out from that it was very specific to different countries, that not that much work, to say nothing, had been done across borders in Europe. So we invited experts, both nurses, experts, but also neurologists co-working with nurses at the headache centers, to be part of an expert panel within our Delphi design. And the Delphi design means that it's questionnaire rounds. And we did 3 rounds of questionnaires to the experts. And for the first one, we stated what is known in the literature and had them rate if that was important for nurses to do and to conduct. And we also asked them to contribute with their own words, what they thought nurses should do in migraine treatment. And between the questionnaire rounds, we gathered data, both qualitative but also quantitative data. and analyzed these data and made them into statements about nursing and roles and tasks. And we had the experts to rate these statements across the questionnaire rounds. And after the third round, the statements which had received 70 or more percentage of agreement were included in our final recommendations. So that was kind of the methodology approach to this study. So now you can say that the recommendations are expert-based because we have cooperated with a lot of experts. There were invited experts, and experts participated from 10 different European countries. There were 14 nurses and 7 neurologists. So that was very nice, and we are very pleased that that many had the opportunity to participate. So.
This is great. And what did your study results were and conclusion?
Yeah, so what has actually happened with all these different kinds of statements? We actually got a consensus on 42 of them, which was, I think, a little bit of above 2/3. And the consensus was very close to 100%. So that was, so I think that the recommendations are quite strong, actually, because we reached consensus from the 10 countries. And so we divided the results into kind of two groups, 2 recommendations for the nurses when they work in the clinic, and also another group where we describe the nurse's role and recommendations for how the nurse's role is within education of colleagues, and that will be nurses, of course, but also maybe young neurologists, so that because the multidisciplinary approach to our patients is very important. So this is how can we actually, as nurses, be part of the treatment of our headache patients. So we ended up with these two different groups of recommendations. To start with when you see the patient for the first time.
Excellent. And I believe there were also recommendations on follow-up role, right? We can work together with our wonderful nurses and maybe follow up with the patient even after first education and first appointment. Is that right?
Yes, that's correct. In our research article, we ended up portraying our results as the final recommendation as a working tool for nurses. So in the paper, there is a table with the recommendations outlined as some kind of schema to use in the clinic, so they can see what they're supposed to do and how they're supposed to do it. So it's a working tool, and that was very important for us, that it was usable for clinical nurses and not only for academia, but also in the clinics.
Well,
yeah,
we
that is
definitely...
important. And we also found that actually that what is really important is that when we see the patients for the first time, to get the dialogue going and ask also for the expectations of our patients, because we as healthcare professionals, we can have one idea of, because we are the experts, but we have to be aware of that our patients, they are the experts within their own headache. So this is one of the main thing from the first contact, is to kind of talk about expectations from the patients, because that's the way we can, as nurses, be part of the treatment, and then educate the patients and also advise them, and in that way make sure that they actually adhere to the treatment plans that the doctors and we as nurses have made for them.
This is fantastic. This is really patient-centered approach.
Exactly.
Thank you so much for this work, and I hope our audience will review and use this toolkit from this excellent article in Journal of Cephalalgia. And congratulations again on this wonderful work. And we hope to see again you in the Journal of Cephalalgia with more wonderful articles and research. So thank you so much.
Thank you so much, Nina, for having us today to talk about our work. Thank you.
Yeah, thank you very much, Nina. Thank you.